today we'll have a small discussion on peripheral and central vertigo. We have to know the difference between these two. So the most commonly what we write in the ER is BP, BP, PV and PCS stroke. So BP, PV is a you can see in peripheral vertigo, and PCS stroke central vertigo. So see, I'll write it here: peripheral and central. Usually in peripheral vertigo, this will be a sudden onset. So you have to ask the patient. So when the patient is complaining of vertigo, whether it is a sudden onset or it is a gradual onset. So usually in peripheral it will be sudden, and in central it will be gradual. And most of the times in peripheral vertigo, most of the time patient will be having nausea or vomitings. And in central vertigo, it is variable, like it may be or may not be. Okay. And then the CNS symptoms and signs. Usually it is absent in the peripheral vertigo and it is present in the central vertigo. And we have to know about the hints examination. If you do this hints examination, it will be very easy to tell whether patient is having a BPPV or PCS stroke. So I will discuss briefly here. So what is hints examination? So hints examination stands for head impulse nystagmus and test of skew. First one is head impulse test. You have to check for nystagmus, and TS is test of skew. Right. So how do you check for head impulse? We call it as, there is a sign called, we call it as saccade. What is saccade? So suppose this is the face of the patient, these are the eyes, nose and mouth. Okay, so normally what we do is, like, we have to hold the head of the patient with our hands, and you have to tell the patient to look into your eyes. Okay, and look into your eyes, and then you have to tell the patient that you are moving the head of the patient to one side, so that the patient should be looking only you. Okay, right. And then suppose if the patient, after you turn the patient head to one side, and if the patient maintains the gaze, so that is normal. That patient is not having saccade. It means no saccade will be there. And when the patient will be having saccade, suppose the patient is looking at you, and you turn the head of the patient, but the patient will not maintain the stare at you. In which direction you turn the face, the eyes will be, he will be seeing in that direction. If you move the head to one side, like if you move the head to left side, the patient will be seeing the left side slowly, and then slowly the patient will be moving his eyes towards you. So then it is called saccade. Okay, so normally saccade will be there in peripheral vertigo. There will be saccade. Okay, and central vertigo, no circuit. It means patient will be maintaining the gaze. Even if you turn the head also, he will be looking at you. That is called no circuit. And then the next one is nystagmus. You know the nystagmus. Suppose eyes will be there like this, and if you tell the patient to see to the left side in this direction, the eyes will be moving back and forth, both eyes. This is nystagmus. So normally in peripheral vertigo, the nystagmus will be only unidirectional. Central vertigo, it will be bidirectional. Okay. So suppose if the patient is having some infection or any abnormality in the ear, so if you ask the patient to look to the left side, suppose the left ear is gone, so if you ask the patient to look at the left side, there will be nystagmus only in this direction. And if you ask the patient to move the eyes to the right side, there will be no nystagmus. So that is, there will be only in one direction. So it is unidirectional nystagmus that will be seen only in the peripheral. And in central bidirectional means patient will be having nystagmus in this direction and as well as in this direction, and also horizontal, and also in the vertical. Vertically you will be having, if he looks downwards in this direction also, patient will be having nystagmus. So in central vertigo, patient will be having bidirectional nystagmus. In peripheral, there will be unidirectional. And the third one is test of skew. So in the test of skew, what is test of skew? Test of skew is face the patient, look at the patient, and tell him to close one eye with one hand. Not close, just close the eye with one hand, and after 5 to 6 seconds, tell him to remove this hand. Afterwards, what you will see, he will be like the eyes will be in the same position. That is normal in peripheral vertigo. And in central, you close the hand, and if you tell the patient to remove his hand, the eyes will be, the normal side will be in the, the eye will be in the center, and the affected side will be going upwards. So this is called skew, vertical skew. Sorry. Yeah.